you've been back for, like you mentioned, about 6 years now, and you've worked in the UK, a lot of these large corporates, etc. What are the biggest difference you've seen between the two that you thought was a stark kind of contrast in how they approach uh, health, wellness, mental health?
I think the one starting point to say is that both systems have very, very good doctors. Right? That is not a problem. So the quality of doctors in both systems, in fact, a lot of the doctors in the UK system are trained in this country. Right? So the doctors in both systems are excellent. Right? That's the starting point. So that's a big similarity, that you get to work with really good professionals, and not just doctors, but also nurses, other healthcare professionals that are very high quality. Right? So that's and then very committed people on both sides. Now, the obvious big difference is that the UK health system is publicly funded, and the care is free at point of delivery. Whereas the Indian health system does have elements of that, but it's also a combination of a large private healthcare provision and public healthcare provision, right? Uh, the the reality of the Indian healthcare ecosystem, which requires a lot more supply, right? Because given the population size and complexities and the level of morbidities, you need a lot more supply in the Indian healthcare system that's currently provided. And that's why you need multiple players, whether it's the government, whether it's individual practitioners, whether it's hospital chains, whether it's single specialty chains, whether it's digital platforms. You need multiple providers to work together to meet that need, right? So, I mean, this is a space, this is a country where you're still not worrying too much about competition in healthcare as such, because there's still such a huge unmet need. The bigger challenge here is to make sure that that people access services in a timely manner, that that offerings are made available at different price points to people based on their affordability, right? So and then there has to be a huge emphasis on wellness and prevention. And I'll tell you why. Because given the size of the problem, right? Given the size of any healthcare problem, whether it's cardiology or diabetes or mental health, given the size of the problem we're talking about, it'll always be very difficult to have the entire problem solved just from a treatment perspective. See, healthcare has never been healthcare for the last 50 years. Healthcare is illness care. That today, worldwide, what people provide is illness care, right? It's not health means absence of illness.
Right.
So what we provide is illness care. When people fall sick, we treat them. Now, treating people once they've already fallen sick, is harder, it's more difficult, and the outcomes are poorer. So you're much better off actually making sure that people don't fall sick. So creating systems, whether it's with insurance partners, whether it's with government, whether it's with employers, that incentivize people to look after their health and to tell people how to look after their health, physical and mental health, will really create an ecosystem where we're actually delivering true healthcare, which is focusing on wellness and prevention. And then that is the only way you can meet the needs or the healthcare needs of this population. Otherwise, the country is so huge and vast and diverse, the number of people we have here, that there'll always be an unmet need. No matter how much private players and governments do, unless we focus on the prevention part, there'll always be an unmet need that won't be met.